Now in this animation CD, you are going to see how exactly these three exercises of lumbar spine distraction, abdominal strengthening and back balancing actually help in correcting the basic pathoanatomy. Before we see how they help, let us see how exactly correctly they are being performed. Because if the exercises are not performed correctly, they may not give the desirable result. In abdominal strengthening exercise, patient has to lie supine. First of all, he flexes his both hips to 90 degree. Then he has to extend both his knees to 0 degree. Then he has to stretch his both feet towards his belly. And then he has to maintain this position and count 1, 2, 3, 4, 5. After counting is finished, he has to bring back his both the feet gradually to the floor by flexing both knees gradually. In doing abdominal strengthening exercises, by first flexing both hips to 90 degree and then extending both the knees to 0, actually help in avoiding undesirable load coming on lumbar spine. This undesirable load would come on lumbar spine if the same is done by flexing hips to 90 degree, keeping both knees extended. In lumbar spine distraction exercise, patient lies supine. First of all, patient brings both his thighs close to the abdomen as much as he can by flexing both hips and knees. Then he holds great toes of both feet with respective hands as tightly as possible, keeping hands between the thighs. Gradually, patient extends his both hips and knees as much as he can without lifting buttocks from the floor and keeping trunk and head flush to the floor. After achieving maximum possible extension at knees, patient maintains the position and counts 1, 2, 3, 4, 5. After that counting, keeping both his feet held by hands, patient brings back both his feet to the floor gradually. Now let us see the mechanical changes occurring during lumbar spine distraction exercise. Initially, there is active contraction of flexors of both hips and lumbar spine. Both hands holding both feet actually stabilize the upper part of lumbar spine during the rest of the exercise. While extending hips and knees, there is a stretching of iliopsoas and hamstrings on both sides. There is simultaneous isokinetic contraction of abdominals and extensors of lumbar spine. Overall, there is downward pulling of pelvis by a posterior rotation of both extending femoral heads, which leads to distraction of lumbar spine. This distraction actually helps in opening up of disc space and neural foramen. In back balancing exercises, patient rests both his buttocks on his heels, keeping both the knees fully flexed. In other words, patient is sitting on his heels. The trunk is kept straight and 90 degree vertical to the floor during whole exercise. Patient then gradually lifts his both buttocks from his heels as high as he can without bending trunk and keeping both hands on sides and not supporting in any way. He maintains the highest vertical position and then counts 1, 2, 3, 4, 5. After that, he brings back his buttocks to his heels and rests again. In back balancing exercise, there is a principle of maintaining center of gravity by trunk while changing posture. When patient sits on his heels, keeping both knees on floor, both the flexors and extensors of lumbar spine are relaxed. The moment buttock is lifted up, keeping trunk vertical 90 degree, there is simultaneous contraction of flexors and extensors of lumbar spine. This is an attempt of trunk to maintain center of gravity in changing posture. This exercise actually improves the proprioception of trunk muscles, increase the tone of abdominals and extensor.